Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about advice to people who are wanting to make the switch to medical coding. Perhaps you are in the medical field already and you want to make the switch over. What are some of the questions that you may have? This episode was inspired by a viewer who is in this situation, and she sent in all of these questions. I think these questions were very well written, and I'm just going to do a whole episode about this because there's so much to go over. So what I'm going to do is I'm going to read this email and then I'm going to talk about it. So let's get started. All right. Hey, Blue. I just started watching you. You are so adorable. Thank you. I am a medical imaging professional, and I have been working in the clinical field professionally for about 6 years. I graduated with a BS, and I have 2 professional certifications, radiography and MRI. I am looking for a career change, as I am tired of clinical life. I do care deeply about my patients, but the job has become too physically demanding for my messed up back. It is good money, but I know I would thrive in a remote job. I know you had mentioned that it is rare for a newbie to get a remote job, but would my experience help? I don't mind working remotely for a couple of years, but I don't mind not working remotely for a couple of years, but working remotely and being able to stay within the medical field is my goal. I know you don't talk about money. But I would assume that going from an MR tech to a medical coder just starting out would be a pay decrease. Is it worth it for me to give this a shot? Do I have a leg up at all? Would I have to go back to school? I am hoping to study on my own. Is this possible? Lastly, I want to pick a credential that makes sense for me. I am just like you. I love to learn, research, and share my knowledge with others. If I do end up doing this, I know I will excel. Given my background, what credentialing agency should I go through? Does it matter? What credential would give me the most opportunity? I want to take your advice, and I just want one credential, but I want to make the right choice. Thank you in advance. All right, so thank you for your email. Thank you for all of these really good questions, and I will be addressing everything. All right, so let me start out by saying this. There are plenty of videos in my collection talking about the 2 Medical Coding Association powerhouses. There's the American Health Information Management Association and the American Academy of Professional Coders. Both have their entry-level credentials, which is the CCA for AHIMA, the Certified Coding Associate, and they have also the CPC-A with the American Academy of Professional Coders. Now, with AHIMA, I will say this. If you do meet the educational requirements, you can sit for a higher credential, which is the CCS. The CCS is a Certified Coding Specialist. This is the gold standard of medical coding credentials because this one credential says that you can code both inpatient and outpatient, but you have had to have met the educational requirements. So it's time in like previous credential or educational requirements. So you'll have to check with AHIMA to make sure that you can sit for this exam. And if you don't, then that's fine. There's still the CCA, again, the Certified Coding Associate, and this is their entry-level credential. This just says that you have no previous background in medical and you're brand new. So, or perhaps you've had experience before and now you're taking your certification because this is the one that you can take without having to go through a formal program. So again, contact AHIMA for their requirements and see, because you already have the education. I just don't know what your Bachelor's of Science is in. So be sure to check with them on that one. But yes, it is absolutely possible to study on your own and take this. I will say that if you're going to try to study for the CCS on your own, because say for instance, you've met those educational requirements, it is a huge undertaking because it's not just learning only the outpatient side, but you have to learn the inpatient side as well. And both have their own different rules. And then they have their own separate books. So with the outpatient side, the procedures, the diagnosis is the same book, whether you're coding for inpatient or outpatient. And that is the ICD-10-CM book. If you are coding for procedures on the outpatient side, you're going to be using the CPT book, or the current procedural terminology book. If you are coding for the inpatient side, you're going to be using a book that is called ICD-10 PCS. So you would have to learn both coding systems on your own as far as like the procedures go. You'd have to learn about E&M as well. It's not impossible, but it is a big undertaking. So I will say that. But if you just want to study on the outpatient side, start with the CPT book. Then if you want to go with AHIMA, the CCA is the way to go. If you want to go with AAPC, the CPC, same thing, outpatient. And it's going to be using the CPT book for their procedures as well. So it's entirely up to you. There are many books many videos in my collection where I talk about the difference between the two. So I'm not going to bore you guys with all the rest of that stuff. I will probably link some videos down in the description box below. But I will say this, if you are considering doing a career change from something else in medical to medical coding, there are nurses that have done this. They have transitioned from being nurse, full-time hands-on nurse, floor nurse, unit nurse, into medical coding. Now, some of them were able to pick it up quite quickly, but there is a good amount of nurses that had struggled to learn the coding, because the rules that we have to follow, it's not just like how the nurses sometimes they think. Nurses sometimes think that coding is just selecting codes. No, we've got to like look at the documentation, read it, comprehend it, and we have to apply the rules that we know in order to make sure that everything is picked up correctly. So it was a really quick learning for a lot of nurses, but if they're able to get through it, and a lot of them are happy that I've talked to doing medical coding now, because, you know, sometimes just being in a physically demanding environment was too much, but they still wanted to be able to use their knowledge, and being a medical coder was really good for them because they could still use that. And a lot of times with nurses, they are tasked to be the clinical documentation improvement people because they know what a document should look like, so they know if there's anything that's missing. And coders tend to know this if they apply themselves and they really start to dig and understand what's happening. Then they'll know where they can help to improve for this particular provider. So for you that you have radiology and MRI, those wouldn't be, I mean, obviously you'd have your anatomy, physiology, and medical terminology down. That is half the battle. If you ask any medical coder, it is half the battle when you're learning medical coding, just to get that part down, right? The anatomy, physiology, and medical terminology. I liked all that when I was in school. So, I mean, I get it. It is a lot. It's a lot. And especially if you've never been in the field before. But having that background is going to help you, because at least you're going to be able to understand. But your experience being this MRI and radiology person, it's not going to help you as far as like, oh, well, she has previous experience doing this and she's going to be able to get a job faster. With medical coding, it doesn't matter what you did previously. What they want is experience. Every employer wants this. Is it difficult to get a job in the beginning? Of course. But this is why I always tell you guys, even if they're asking for experience, you have to still apply anyway. You have to have a really good resume and a really good cover letter. And as long as you have those things and you have a very persistent attitude and a positive attitude, and you guys stay away from any negative sources of energy like those Facebook medical coding groups that I tell you guys not to get involved in, because those are a hotbed of negativity at times. So I want you guys to, if you are considering this, be very selective on who you're asking questions to. Do not ask anybody and everybody. Be very selective, because what you hear from different people is going to be different. There are some people who you will ask, well, what about medical coding? And they're going to tell you every horrible thing they could possibly think of. It's going overseas, and it's just too stressful, blah, 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 blah. There's all of that. You can't get a job. And I mean, it's just horrible, the things that they say. If anybody listened to them, they'd never do it. But then if you ask somebody like me, who's been in the field, who knows it, who understands it, who really truly does love it, you are going to hear the good and the bad. This is why I tell you guys, good and bad. I do not sugarcoat things. I tell you guys straight because I don't think that you guys should be lied to. Which brings me to why I don't talk about money, but you still ask me the question. So I am going to put this as very bluntly as I possibly can. Every place in the US is different. I don't know what an MR tech gets paid. And I will say this, you've been in it for 6 years. You cannot expect to start in a place, in a job, and make the same money in a brand new place that you've been making, and your salary is 6+ years in. You can't expect to start at the same. That's unrealistic, right? So the thought is that you are going to start at whatever the price range of a medical coder is in your area. And again, a lot of factors go into it. Is this a public hospital? Is this a private hospital? Is this a government facility? Is this, how many years do you have in? There's a lot of different things that go into this price that you're going to start out at. But you're going to start there. You're not going to stay there. And people sort of get tunnel vision when it comes to the salary, the salary question. And they get mad at me. And I'm probably going to get people get mad at me for this one too. But here's the thing. I'm not going to sit here and lie to people and tell them this exact number, because that's what everybody wants from me, is an exact number. I'm not going to give you guys an exact number. I will never give you guys an exact number because, again, it's different everywhere you go. That's not my rules. That's wherever, you know. But there are people that will tell you a ballpark figure. Some people will think about this number, and when they get out into the real world and they see what's actually being paid to brand new coders, they say, oh no, that's too low. And they want to go for that number that people told them, which is why I don't do that to you guys. The money is there. Don't get me wrong. The money is there. You don't have to worry about that. What you got to concentrate on if you want to be a medical coder, and a high caliber coder at that, is understanding what you're doing, learning. That's where you need to be concentrated on. Then, like I said, the money will come. Don't worry about that. But you just have to make sure that you are doing everything correctly. Because what we do as medical coders affects so many people. It affects the provider. It affects the facility. Most of all, it affects the patient. It affects the patient because if the coding is done wrong, then the billing is being done wrong. If the billing is being done wrong, the patient's doing one or two things, paying too much or too little for what the services that they received. So it's very serious. And that's why I always take this off of my channel. I never talk about this directly. I don't know, like I said, what a tech makes versus what a coder makes in your area. So that is something that you're going to have to do your research on. But like I said, you're not going to stay at the starting price forever. You still have to get trained, and then you're going to move up if you choose to do this. And if you are saying, well, it's getting physically demanding to be in my position, I understand. Like I said, nurses have talked about the fact that it's hard on their bodies. I mean, because you're like physically working with patients and things. So it's entirely up to you if you want to make that switch to something that's less physically demanding. It is, and don't get it wrong though. Just because it's not physically demanding does not mean it's not tiring. Because to think all day long, there are times when I'm at work and I'm in hard charts all day. Hard, difficult charts. Or I have my boys that are giving me a hard time because they're doing something they're not supposed to. As far as like picking up extra codes. And I'm like, what are you guys doing? This is not even here. Why are you picking this? And so I have to go in and correct a lot of things. And so if I have to go in and change the diagnosis selection because they're running amok, you know, it's very physically draining. I will come home and be exhausted. So like I said, I've worked in physically demanding jobs, and trust me, you get just as tired doing a mentally driven job. You know, if you are doing an intellectual position, it does get to be physically tiring as well. And you have to be able to take care of yourself because we are sitting majority of the day. Or if you're like me, where I sit a lot of the time, but there is times that I have to be running around and I'm chasing providers down, and I'm trying to get them to to let's talk, because you know, I need to make sure that things are clear here. And so it just depends on what you are doing. But I always say you have to take physically good care of yourself. You have to eat right, and you have to still do exercise even if you are in a position of, you know, medical coding, because the more you have a sedentary job, the more you're going to have to work at staying active. Otherwise, you're going to get stiff. You know, you're not going to, like, you get uncomfortable when you're sitting down, and you don't want that. You have to be able to stay limber, and that is very important. And something that doesn't get talked about a lot in this field is the importance of staying limber when you are a medical coder, because it is going to be able to keep you sharp. It's going to keep you awake, especially when you're reading all day. Sometimes reading puts people to sleep. And if you are already tired, you know, that goes hand in hand with that. And you need to make sure that you're mentally sharp. So staying limber helps, and taking good care of yourself really does help. Getting the adequate amount of sleep, that is also very important. Although I know that, you know, it's different for different people. So, I mean, it's all up to you. You just have to take care of yourself. But, you know, as time goes on, you know, if you're not taking care of yourself, it's going to catch up. So, I mean, if you want to make a career switch, hey, by all means. I would never tell you guys overtly do this or don't do this, but I'm like, as far as making a career switch, I let you guys have your own choice. And when it comes to which association would be better for you, the American Health Information Management Association and the American Academy of Professional Coders are both the medical coding association powerhouses. So these are the two worldwide recognized. If you are trying to sit for anything other than this, I would strongly recommend that you reconsider, because if you are looking to be a seriously competitive medical coder, you need to have one of those two credentials through them, okay? Either one. And I mean, to me, there's good coders in both associations. It's the caliber of the coder that's going to matter and make a difference. So if you are if you're wanting to do that, well, I'll just give you an example. If you take the CCA exam, again, I don't know if you're eligible to take the CCS. You may be, but for example purposes, the CCA, which is the entry-level credential for AHIMA, is a 2-hour exam. This, don't let this 2-hour exam fool you, okay? Because it does pack quite a punch. You can look on the website for their pass-fail rates for first-time test takers. Now, there was 34 people in my class when I took it. I was the only one to pass on the first try. That is how difficult this test is. And you have to know a lot. And again, you got 2 hours to take it. And AHIMA, they do allow, they do have a member price and a non-member price for their certification exams. Whereas AAPC requires you to be a member of their association before you can sit or pay for their certification exam. So that's an additional cost there. I can't think of the cost of their association membership fee off the top of my head, but that, just so you know. And AAPC's exam is 5 hours and 40 minutes for their exam. But they do allow you to have a free retake if you do fail the first time. And AHIMA does not. So there is the difference there. Some people, they like the security of being able to, like, okay, I get really bad, if they get really bad test anxiety, and they say, well, you know, you can get a free retake. That helps some people, okay? They just need to sort of have that reassurance, you know, because these tests are not cheap. And, you know, it's what you need, though, to get in. You know, it's what you need to be taken seriously. But yes, you absolutely can learn on your own. I think I've addressed all the questions. But as far as the worthiness of it being, you know, worth it to you, it's entirely up to you. I can tell you that I've been in it for over a decade. I love it. But I didn't get like this overnight. This happened over time. But I did have my aha moment in my career. And some people have it and some people don't. But if you truly love what you do, and as I've said it originally, 400 plus videos ago, if you love what you do, you never work a day in your life. So you have to really think about what it is that you're doing with your life. Because we only get one rodeo, folks. One. That's it. And you got to make the best of it. So if you are in a position where you're wanting to make a change and you're like, gosh, you know, I hate going into work and I don't want to be here, then it's probably you're doing the wrong thing, right? You're probably not in a career field that you love. You should be in a career field that you love, and you should be doing things that you enjoy. That's all I'm saying, because you know, we're in this for 20, 30, 40 years working, you know. But it's you got to really enjoy what you do. Okay. And like I said, for me, I really love it, but then I'm a nerd. So, and I live and breathe this stuff, you know, and I created my channel to share it all. So, and I don't have just one channel. I have two channels. I have, YouTube, and of course I have Patreon, and, Patreon is for exercises that I do on medical coding and terminology, crossword puzzles and things like that. And I talk about different scenarios and things. When it comes to medical coding, I have it all on my Patreon channel. And I just enabled the annual memberships for my Patreon channel. So I have pledge levels that start off at just $1 per month. But if you do the annual membership, you get a 10% discount. So then that applies to all the levels. So if you are interested, I hope you'll check out my Patreon channel. I'll leave the link down in the description box below. It is my 1-year anniversary next week. I'm so excited. But anyway, before I get off into Patreon, I just wanted to let you know that. And I do personally offer tutoring. So if you are studying on your own and you need somebody to explain it, if you're not a member of my Patreon, it's $25 per hour for the first hour and then $15 for the second hour. If you're a member of my Patreon channel, it is $20 an hour for the first hour, $15 for the second hour. So that is an option if you are going to go the independent route and you just need somebody to explain it. You know, there's always that option. And I'll leave my contact information down in the description box below as well. So I think that's about it. But I hope that this has answered all of your questions. Thank you so much for your thoughtful email, and I wish you the best on your journey, whether you pick going into medical coding or not. Like I said, everybody should do something that makes them happy. So do what is best for you. Decide for yourself and think long and hard before you do anything. And that way, you know, you'll know. But I have got plenty of videos that break down the differences between the associations and the credentials and everything else. So like I said, I'll leave them down in the description box below. And I'm going to go ahead and wrap this one up. So one other thing, there will not be a show tomorrow on Tuesday, November 3rd. There will not be a Q&A Tuesday this week at all. Q&A Tuesday will be back next week at the regular time on November the 10th at 7:30 p.m. Central Standard Time. I will see y'all on the next video. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!